Bismillahirrahmanirrahim. Welcome to another lecture on human factors engineering. We are on module 1, that is physical ergonomics or body-centered ergonomics. Today we are going to discuss work-related musculoskeletal disorders or WMSDs. These are the references that I consulted to make the slides. You can read the relevant chapters from these references if you want to go into details of this topic. At the end of this lecture, you should be able to get familiar with epidemiological terms, especially incidence, prevalence, and odds. You should be able to differentiate between work-related musculoskeletal disorders and cumulative trauma disorders. These are two very much related terminologies. They have almost the same meaning. There is a slight difference between the two. So you should be able to understand the difference. But some authors use them interchangeably. Identify the mechanism, causes, and remedies of some of the most common work-related musculoskeletal disorders. For example, strains and sprains, some tendon disorders like tendinitis, tennis, novitis, and trigger finger, osteoarthritis, epicondylitis, cervical spondylosis, carpal tunnel syndrome, and some disorders of the shoulder. What is epidemiology? Epidemiology is the study of distribution and determinants of the disease or health outcomes in specified population, and then application of this study to the control of the health problems. So this field is called epidemiology. Generally speaking, there are two roles of epidemiology. One is prevention and other is intervention. So ideally, a disease or a health problem should not occur, and if it does in a population, then there are different interventions that the experts of this field can make to stop or reduce the spread of that medical problem. Measures of health outcome occurrence are different. The more common, especially for human factors specialists, are prevalence, incidence, and odds. There is some terminology related to epidemiology. One of them is exposure, the condition of being subjected to something, be it an infectious agent, extremes of weather, or mechanical loading. So that is called exposure. For example, a worker is exposed to high temperature, or he is exposed to mechanical loading or heavy material handling. So that is the condition of being subjected to something that can affect the health outcome. Now, what is an outcome? A change in personal condition, normally as a result of one or more exposures. So outcome, for example, can be a back pain, it could be carpal tunnel syndrome, it could be, for example, cramps or something like that. What is the case? Case is an individual who has developed the outcomes of interest. So nowadays you hear the cases of, for example, COVID-19. So these are the individuals who have developed the outcome of interest. So case is an individual who has developed the outcome of interest. So a term that is normally used is number of cases, for example. But there are two separate terms actually that help us explain the number of cases. One of them is prevalence, the number of cases of a disorder at any particular time. And incidence is the number of new cases over a time period. And odds is a statistic that describes the likelihood of an outcome given exposure to a risk factor. So here are the formulas. Prevalence is the number of prevalent cases, that is total number of cases of a certain disease or disorder divided by total study population. Generally, it is expressed as a percentage. Incidence is the number of incidence cases, or you can say the new cases. during a certain period of time. And denominator here is at-risk study population at start of study period. So both are very useful in human factors. Odds is the number of cases divided by number of non-cases. So these ratios are used in human factors and in, of course, epidemiology in general as well. So what is this term meaning? Work-related musculoskeletal disorders. These are the disorders of the muscles, skeleton, and related tissues which have been empirically shown or are suspected to have been caused by a workplace activity. Now, practically, it is very difficult to determine whether a certain disorder is because of the working conditions. So you could notice the second part of the statement that they are either related to the workplace or are suspected to have been caused by a workplace activity. Because it is very difficult to develop a cause and effect relationship whenever we are talking about the WMSDs. A related term is CTD, cumulative trauma disorder, or in some countries, RMI, repetitive motion injury, or repetitive strain injury. That means almost the same thing as WMSD. But specifically, CTDs are the disorders that develop over a period of time. Some of the WMSDs can develop suddenly, very few. Most of the WMSDs develop over a period of time because of a certain exposure. So specifically, such disorders are called cumulative trauma disorders, the disorders that develop over a period of time. But some authors may use them interchangeably. Now, from human factors point of view, what are the occupational factors that cause musculoskeletal disorders? So the main occupational factors associated with the musculoskeletal conditions are excessive force, awkward postures, repetition or frequency, the duration of the task, vibrations, and of course, you could think of other variables as well. And in several cases, exposures to more than one factors causes a large increase in the prevalence of the disorder. So it could be, for example, a combination of frequency and bad posture, or it could be, for example, a combination of excessive force and duration and so on. So basically, whenever someone is performing a physical task, there is some tiredness and fatigue, and that generally goes away with rest and nutrition. If it doesn't go away, some problems develop within the body. So as a whole, this flask is your body, and this level of water is showing the level of disorder that you are having. And that is the result of the job that you are performing. Now, if the rate of healing is sufficient so that whatever is the level of disorder, it goes away with rest and nutrition, the worker feels stable and healthy and can continue the work. But if the healing is not proper, then with the passage of time, over a period of time, the CTD or WMSD keeps on developing, and at certain level, it exceeds the capability of the human body. And this is when the symptoms actually start appearing. So then that disorder is diagnosed and it is called CTD or WMSD. So it is important that the job should be designed such that this rate of trauma, this negative effect of the job should be as less as possible. But still, there is some effect that cannot be eliminated. So that effect that is still developing should go away with healing. And healing here means rest, breaks, nutrition, proper routine medical aid if it is required. But if that healing rate is small as compared to the rate of trauma that is developing, then the disorder develops over a period of time. So what is the result? A beautiful result from this figure is that the job design should be such that this factor is as less as possible. And even this healing valve also relates to the job, especially when it comes to the rest breaks and changing the nature of the job, etc. So we will discuss some common WMSDs, and if you remember this point, it will make it very easy for you to understand different disorders. So for each of the disorders we will discuss, pay special attention to the component of the musculoskeletal structure that the disorder is related to, whether that disorder relates to the muscle, tendon, ligament, bone or joint, cartilage, bursa, etc. And secondly, the location of that disorder. If you pay attention to these two factors, what body structure that disorder affects and what is the location of that disorder. For example, a disorder may affect tendons, but you have to see whether they are the tendons of, say, your fingers, or for example, there is a tendon in the forearm. So location is also important. So if you pay attention to only these two factors, then it will be very easy for you to remember those disorders. And the third factor, if you can pay attention to that, is the reasons or causes of that disorder. First, strains and sprains. A strain is a particular injury caused to a muscle or tendon. The muscle strain or tendon strain. Strain occurs when the fibers of the muscle or tendon get torn due to overstress or overstretching. Sprains, on the other hand, refer to an injury caused to the ligament when stretched beyond normal capacity, which may result in tearing at times. So for example, one of the common sprains is twisted ankle. So twisted ankle is actually tearing out or injury to the sprain that is attached to the ankle joint. So strain occurs when muscle or tendon, and you remember what is a tendon, that is a tissue that connects muscle to the bones, is overstretched. Strains are usually caused by putting stress on tight or weak muscles. Sprain is a tear in a ligament, tissue that connects bones together. Sprains are caused by a sudden forceful twisting of a joint. This causes the joint to misalign and the nerves to become chronically irritated. You could see stretched muscle, so that is strain, and torn ligament, that is sprain. So that is the ankle sprain. The twisted ankle generally results in the sprain or the tearing out or the overstretching of the ligaments that are wrapping around this ankle. Muscle cramps are also very common. The cramps generally result from overexertion and dehydration. So when you don't have enough fluid in your system, it leads to an electrolyte imbalance that causes your muscles to cramp up. So when there is a lot of heat and you are sweating a lot, then cramps may develop. So that is a reason, having insufficient fluid in your body. But there could be other reasons as well. Cramp in the hand or forearm is known to be more common in those jobs that involve prolonged handwriting, a lot of typing using keyboard, or other repetitive movements. If there are, especially the movements that are very restricted or that prolong over a period of time, are related to the small muscles, like muscles in the hand or the fingers, then cramps may develop as well. So you might have experienced it when solving a long paper. So some of you might have faced cramps in your fingers. Cramp is more likely when extreme postures have to be developed, since these postures weaken muscle joint systems. So extreme postures and lack of fluid in the body cause cramps. So cramps are, for example, very common in the sportsmen as well, especially during summer season. Now there are a number of problems that are related to tendons. So tendon pain can have many different forms. We will discuss few of them. One of them is trigger finger. It occurs in the flexor tendons of the finger. And if you may remember from the first lecture, that the flexor muscles are on the palm side, right, on the anterior side of the hand. The tendon can become nearly locked up. They do not glide smoothly, so that the movement of the finger is sudden and jerky. This condition makes it difficult to straighten the fingers back out. It can also cause pain, discomfort, and swelling. Trigger finger can occur in one or more fingers or the thumb at the same time, or it may occur in different fingers with or without thumb movements at different times. So you might have seen or experienced this problem. So you could see here that in this case, the tendon of index finger has swelled. So the finger is bent at an angle and it is very difficult to straighten this finger. And you could see that the tendons in the hand are very long. And the muscles actually that flex the fingers and the hand as a whole are in the forearm. And you could see the long tendons originating in the forearm and extending in the fingers. So if any of these tendon locks up or it swells, then it is very difficult to straighten that finger. So situation like this occurs and it is very difficult to move or straighten the finger. So trigger finger is a very common problem. Now, remember the trigger finger is swelling or locking up of the tendon itself. The tendon is moving inside a sheath. Sheath means cover. The tendon moves inside a cover or a sheath. Now, if that cover swells, then it is called tenosynovitis. So this is an inflammation of tendons and especially the sheaths that cover the tendons. It frequently occurs in the wrist and ankle where tendons cross tight ligaments. The tendon sheath swells, which makes it more difficult for the tendon to move back and forth inside the sheath. The sheath is a cover inside which the tendon moves. So if sheath swells, if cover swells, then the tendon cannot move. Now, if tendon cannot move, then the relevant muscle, of course, cannot generate the required movement as well. So I hope you remember the tendons are at the end of muscles. So like any inflammation, the symptoms are pain, burning sensation, and swelling. There is evidence that force, posture, and repetition are all associated with the disorder. The evidence is even stronger when workers are exposed to these stressors in combination. So you could see that the causes are very similar for different disorders. Tenosynovitis. So this is also a problem related to the tendons. So again, tendons are rope-like structures that attach muscle to the bone. Now tendons are covered by a slippery, thin, soft tissue layer called synovium. Just like in the joints, where here we are also having the synovial fluid or synovium. Now this layer allows the tendons to slide easily through the tunnel. So I repeat that the tendon slides within the tendon sheath, and tendon sheath has two layers. And between those two layers, there is synovium. So any swelling of the tendon can put pressure on the nerve. This can cause wrist pain or numbness in the fingers. So here is the figure that is very helpful to understand what is meant by swelling of the tendon sheath. So this thing shown right in the middle is the tendon. So this is the tendon. And what is shown outside is the tendon sheath. So what happens is that this tendon, when the force is applied by the muscle, this tendon moves inside the sheath. Now this sheath has two layers. First is this inside layer and other is this outside layer. Right, so this as a whole is tendon sheath. So you could see that the tendon sort of is not exactly attached to the inner layer, but it slides inside the inner layer of the sheath. So again, this as a whole, this one is the tendon. And again, this is the inner layer of the tendon sheath, and this is the outer layer of the tendon sheath. So extreme postures can preload the finger tendons. So this figure B is simplified view of a flexor tendons of the finger. The tendon A, again this inside, this one is the tendon, is surrounded by a synovial sleeve consisting of an outer layer, again this C is the outer layer, and an inner layer, that is the B. So this is the inner layer, this B. When the tendons move, the inner layer glides over the outer layer. So this is very important. I hope you can visualize that this inner layer, this layer A, glides over the outer layer, that is the C. And between these two layers, there is a lubrication provided by the synovial fluid. Now, if the layers become inflamed or scar tissue builds up, the layers cannot glide smoothly over one another. The tendon then behaves like a rusty brake cable, and smooth, pain-free movement is impossible. So you cannot, for example, if you are having this swelling of the tendon sheath at the wrist, then it is very difficult to move your hand in different directions. So that was a schematic figure. Here you can get even better idea. This is the muscle. End of the muscle is a tendon. So this is the tendon as a whole, starting somewhere over here. And this is the tendon sheath. And you could see that there is this sheet is thick. It has an outer layer and it has an inner layer. And inside the inner layer, this tendon moves. And you could see that ultimately this tendon is attached to the bone. So force is provided by the muscle through tendon and then finally to the bone. So again, the tendon, the inner layer, the outer layer. And inside two layers is a cavity that contains synovial fluid. So outside, of course, there are different ligaments, and you could see the fibrous membrane and synovial membrane. The outer is the fibrous and the inner is the synovial membrane, and you could see this cavity contains the fluid. But because of any reason, if this swells, this tendon sheath swells, then this tendon cannot move inside it, and ultimately the muscle cannot exert the proper force onto the bone to which this tendon is ultimately attached. So this problem, of course, the swelling of the tendon sheath can occur in different parts of the body. So for example, it could occur in the wrist, or it could be in the thumb as well, or other parts of the body. So this is the swelling of the sheath in the wrist, as you saw on the previous slide. So it is having inflamed synovium. So this is for the extensor muscle, the previous one that we saw. For the finger, the trigger finger, that was for the flexor muscle. So these extensor muscles are actually on the posterior side of the hand, and flexor are on the anterior side. So inflamed Achilles tendon that are on the anterior side of your lower leg. So you could see that this problem can occur in different parts of the body. And one of them is the thumb, and in that case, it is called Decker-Vein's tenosynovitis. So it is a special case of tenosynovitis. This is the tenosynovitis of the tendons of the thumb at the wrist. It is characterized by pain on the thumb side of the wrist and impaired thumb function. It may occur due to forceful gripping and twisting of the hand in activities that require heavy use of the thumbs. Activities that require use of the thumb are, for example, using screwdriver, fitting rubber rings on a rope, sewing, weaving and cutting, and so on. So again, as you saw for the wrist and the finger, here is the location of this problem for the thumb. So you could see at the bottom of the thumb, this tendon sheath swells and it is very difficult to move the thumb. Again, the tendon sheath, the inner layer of the tendon sheath, and outer layer of the tendon sheath. If you have any questions so far, you can ask. One of the disorders that is not too common is bursitis, and it relates to bursa. What is a bursa? Bursa provides a cushion between bones and tendons and or muscles around a joint. So you will find bursa around some joints in the body. In fact, there are about 150 bursa in the body. So the bursa helps to reduce friction between the bones and allows free movement. So there are more than 150 bursa in the body that cushion and lubricate areas where the bones, muscles, and tendons move across one another. So you know that at the end of the muscle, tendon attaches to the bone, and this is where you will find the bursa. Now, the bursitis is actually the irritation in the bursa, or it is inflammation of the bursa. So bursitis usually causes pain and stiffness in the tissue surrounding the joints instead of pain in the joints themselves. So here you could see the bursa that is at the elbow joint. So this is the tendon of the muscle that seems to be the triceps muscle. And this is where this tendon is attaching to the elbow joint. And this is the bone. This is the bone where it is attaching to the elbow joint. So this bursa provides the lubrication cushion at this joint, between this tendon and this bone and as a whole at this joint. So if this inflames or there is some problem with this bursa, there could be pain around the tissues at the elbow joint. But this bursitis could be at other joints like shoulder joint or the knee joint and other joints in the body. So there could be disorders that directly impact the joints. And one of them is osteoarthritis. It is a joint disease that normally affects the cartilage at the joints. Cartilage is a slippery tissue that covers the ends of the bones in a joint. Healthy cartilage allows bones to glide over each other. It helps absorb the shock of the movement. So we have discussed the structure of the joints and the function of the cartilage already. In osteoarthritis, the top layer of the cartilage breaks down and wears away. This allows bones under the cartilage to rub against each other. The rubbing causes pain, swelling, and loss of motion of the joint. Bits of bone or cartilage can break and float inside the joint space or the cavity that is between two bones, which causes more pain and damage. There are different reasons of osteoarthritis. It usually happens gradually over time. Some risk factors that might lead to this include being overweight is a big risk factor. Age is an important factor, so getting older can cause it. But with respect to our course, there could be some injury that can cause this problem, or there could be stresses on the joint that can cause this problem. But there could be genetic factors as well. But with respect to workplace, injury or stresses could be the cause of this. But generally in the population, it is more common with the elderly people, with the overweight people. And it could be because of the genetic factors as well. So this is a healthy joint on the left side. You could see the bone, and at the end of the bone is cartilage. So this is the bone, and this is the cartilage, the second bone and the cartilage, and there is space between the two. Now the this cartilage can break, it can get damaged, and you could see there are certain fragments of this cartilage that are there in the cavity, so they can actually cause pain as well. So one cause of the pain in osteoarthritis could be because of the rubbing of the two bones, and it could be because of these particles as well. Now, there could be different problems with the backbone, the vertebral column. So those problems can relate to the neck, they can relate to the lower back, and so on. So first we discuss disorders related to the neck. And causes of the disorders related to the neck can include sedentary posture, too long sitting of a worker, or in awkward posture. And it could be because of twisting and bending of the trunk. We discussed it already that forward bending is the natural movement for the trunk and the neck as a whole, but side bending is more risky, twisting is even more risky, and a combination of these two is even worse. The cervical spine has several functions. We have already discussed the cervical spine, or the part of the vertebral column that is attached to the neck. That is the part of the neck has different functions. It supports the weight of the head. It provides conduit for nerves. That is actually general function of the backbone, the spinal cord, and the nerves pass through it. And it also serves as attachment point for the muscle that control the position of the head. We have also discussed that the cervical part of the backbone, the cervical spine, consists of 7 vertebrae designed to permit complex movements of the head. The cervical spine consists of vertebral bodies and intervertebral discs, facet joints, bony processes for the attachment of ligaments and muscles, and the intervertebral foramen through which passes the spinal cord. So we discussed this point in detail in our module on anatomy, and we also discussed this point in detail in our discussion on work posture. Movement of the head are accomplished by the muscles attached to it and the surrounding parts of the skeleton. So that is important function of the cervical vertebra. The deep, short muscles of the neck serve to stabilize the individual vertebrae. The longer, more superficial muscles produce movements of the spine and head as a whole. So generally, the muscles are layer by layer, one above the other. So inner muscle generally stabilize the body part, and the exterior layer of the muscle or superficial muscle provide the force for the movement. And same is true here in the case of cervical part of the body. Now the posterior muscles of the neck extend it, as we saw in the case of the forearm and in the case of hand, that posterior side contains the extensor muscles and the anterior side contains the flexor muscles. So that is true of the neck as well. So the posterior muscles extend the neck and they are stronger than the anterior muscles which flex the neck. And the reason is the flexion is a natural movement, that is the more common movement, that is forward bending of the neck. So that is why the muscles that are on the front side are relatively weaker as compared to the extensor muscles, which move the neck against the gravity, that is in the backward direction. So they need to be stronger. So the reason is the latter are assisted by the gravity, the flexor muscles, whereas the former, that is the extensor muscles, have to work against gravity. The propels, that is the disorder of the discs. It can occur in any of the disc in the backbone. So the propels of the intervertebral disc of the cervical spine is rare. But it is more common in the lower back, but it can occur in the cervical part as well. But it is more common in the lower back, and especially in disc number 4 and 5. However, the disc can degenerate, as can the intervertebral joints, and this can cause irritation of the nerve roots in the cervical spine. Pain in the neck and shoulder may result. So the propulse of the disc, that is breaking of the outer wall of the disc and leakage of the nucleus, and then pushing of the nerves by that nucleus or the fluid in the disc is more common in the lower back, but the degeneration is possible or relatively more common for the cervical part as well. So here the disc can degenerate and the joints can degenerate as well. But as a whole, these problems are more common in the lower back as compared to the cervical part. Degeneration of the cervical spine, sometimes it is called cervical spondylosis, can have serious consequences. Compression of the spinal cord at the level of the cervical spine can also take place. So you could see here the degeneration of the vertebra as a whole. It has D-shaped, and generally it also occurs with the passage of time with aging. So its smooth structure has deteriorated, and ultimately the vertebra itself or the attached structures can push the nerve roots and it can cause the pain. So how can we properly design the workplace to avoid problems related to the neck? The Grangian concluded that the head and neck should not be flexed forward by more than 15 degrees, so excessive flexion should be avoided. There is considerable evidence that frequent sustained flexion of the head and neck beyond this is related to chronic neck and shoulder pain. So beyond 15-degree flexion, and especially if it is held for a longer time or if it is done very frequently, it can cause these problems. This problem is exacerbated or increased if the flexion is accompanied by rotation of the head, and if the shoulders and arms have to be held in the elevated position. So in simple words, this flexion, if it is combined with rotation or elevation or some other movement, it can become even more dangerous. Something that we have already discussed, that two awkward angles combined together can increase the risk. Another problem that I'm not going to discuss in detail here is the lower back pain. So as we discussed that there could be different reasons of low back pain. So it can relate to the muscles of the back. It could be related to the disc, and disc can have different problems. Disc can degenerate, disc can rupture, or different problems can take place. It could relate to the vertebral bodies, or it could relate to the ligaments as well. So actually that is one of the very common musculoskeletal disorders, the low back pain, and it can have different reasons. But the more common are again excessive awkward posture, sustained posture, or material handling, something that we discussed in greater detail in our discussion on manual material handling, biomechanics, and in the discussion on Neosh lifting equation. So basic idea of Neosh equation is actually to minimize the risk to the back as a whole, and especially the lower back. Another musculoskeletal problem is carpal tunnel syndrome. It is a condition resulting from compression of the median nerve of the wrist. So perhaps the first problem where the nerve is directly affected. So this nerve runs from the forearm into the hand and is responsible for sensation and certain aspects of movement in the thumb and the first three fingers. So we will see this with the help of figure. Combined stressors such as force and extreme posture or repetition are strongly associated with carpal tunnel syndrome. Vibration of the hand and wrist is also associated with the condition. So carpal tunnel syndrome is more common in hand-intensive jobs like typing, fish processing, supermarkets, the checkout workers, or the workers that operate vibrating equipment. So they are more prone to this problem. So the muscle that flex the finger lie in the forearm, something that we have discussed, that flexor muscles are in the forearm, and they have long tendons that pass through the narrow opening in the wrist. So that opening is called the carpal tunnel. Carpal tunnel. And finally, these tendons insert into the fingers. So this opening, the carpal tunnel, is also traversed by the nerves and blood vessels of the hand. It is a narrow passage that is surrounded by many body structures. There are tendons, there are ligaments, and there are carpal bones as well. So an increase in the pressure in the carpal tunnel can cause carpal tunnel syndrome if it affects or entraps the median nerve. So ultimate body structure that gets affected is the median nerve. Or it reduces the blood supply to the nerve by compressing the capillaries, resulting in nerve damage and reduced conduction velocity of neural signals. So there are actually two important nerves that would originate from the upper part of the arm. So one is the median nerve. So you could see that median nerve innervates your thumb, the index finger, the middle finger, and half of the ring finger. So this is that nerve that is just going to the center of the forearm. So that is why it is called median nerve, and you could see the branch roots of this nerve as well. And the other nerve is the ulnar nerve. So you could see this nerve here. So this innervates the little finger and half of the ring finger. So in carpal tunnel syndrome, this median nerve that is passing just through the center of the carpal tunnel, and this is where the carpal tunnel is. We will see it in the next slide. So this nerve gets compressed and it causes pain. So here you could get a better idea of this carpal tunnel. So you could see long tendons. These are the tendons. And again, you could see this blue color are the tendon sheaths. So end of the tendon is covered by these tendon sheaths. And then you could see that across this carpal tunnel, there are these ligaments. And what is not shown in this figure are the carpal bones. You will see them in the next slide. So right in the middle of these tendons and ligaments and the carpal bones passes this median nerve. So this is the median nerve. And you could see that it further branches out into the thumbs and 2 fingers and half of this 4th finger. So when this nerve gets some pressure, extra pressure from these tendon sheaths, swelling of these tendon sheaths can also cause carpal tunnel syndrome. Or too much excessive pressure because of too much twisting of the wrist, then you could feel pain, and that can spread to the thumb and the fingers that are innervated by this median nerve. So apart from the structures that you saw in the previous slide, the tendons and the ligaments, you could also see these bones, the carpal bones. So again, the tendons and these carpal bones, and of course there are blood vessels as well. As a whole, this is the carpal tunnel, and this is your median nerve. So it is surrounded by many structures, and there could be different sources of extra pressure on this nerve. So it seems reasonable to conclude that the redesign of equipment to minimize exposure to vibration, highly repetitive work, and extreme postures may be of value in lowering the prevalence of carpal tunnel syndrome in the workplace. If you have any questions so far, you can ask. Another musculoskeletal disorder is tennis elbow. Tennis elbow. and its technical name is lateral epicondylitis. It relates to forearm, and it is a tendon-related problem. When we use forearm muscles over and over again, small tears develop in the tendon. So we'll see which tendon it is. So this leads to irritation and pain where the tendon is attached to the bone. Every tendon, of course, attaches to the bone. So we will see which specific tendon it is. So it is near the elbow joint. Any activity that involves repetitive twisting of the wrist, like using a screwdriver, can lead to this condition. But as you might have noticed, tennis elbow. So it is also very common in tennis players because they have to apply heavy forces. They have to extend their forearm repeatedly. So this tendon can get damaged and they can have this problem. But apart from these players, tennis and other players like squash players, painters, plumbers, construction workers, cooks, and butchers are all more likely to develop tennis elbow. All these do involve applying excessive forces using their forearm, especially extension. This condition may also be due to constant computer, keyboard, and mouse use. So evidence for work-relatedness, overexertion of the extensor muscles of the wrist, as I mentioned. And you should keep in mind that the extensor muscles of the wrist lie in the forearm. The risk of injury is said to be increased by activities requiring large grasping force. So just like in tennis, but just in the case of butchers, a lot of grasping force is required. Apart from applying extensive force, the force of extension actually, it is extension in opposite to the flexion. So part of this force of extension, large grasping force can also cause epicondylitis. There is evidence for an association between tennis elbow and forceful work, also combined stressors, that is force and posture. So this is the point where this tendon, extensor tendon of the forearm, attaches to the elbow, this point. Extensor tendons. And this point is lateral epicondyle. So that is why this problem is called lateral epicondylitis, because it affects this area, that is lateral epicondyle. So this is the point that is affected. So this is the tendon as a whole. And you could see that actually there are a group of muscles that are attaching to this part, the outer part of the forearm. So as a whole, we are calling them extensor tendons. And one of the muscles that has actually one of these tendons is extensor carpi radialis brevis. So extensor shows that this is a muscle that helps in generating the extension, and radialis means it is attached to the radius, and brevis means it is a short muscle. So this is where the tennis elbow develops, this point. So you could see the related structures as well, radius, ulna, and so on. So again, when large grasping force are required, a lot of extension takes place, there is some ulnar deviation as well. So this problem is increased. The chances of developing this disorder increase. Just opposite to this is medial epicondylitis. So that develops on the medial side, on the medial epicondyle. But the reasons could be very similar. That was called tennis elbow, it is called golfer's elbow. From the evidence available, it would seem that a higher risk job for epicondylitis will be the one that requires high grip forces combined with repetitive work in extreme postures or pronation and supination of the wrist, essentially factors that increase the stress on the tendon insertions. Low friction handles, this is one of the ergonomic interventions that can be made. Low friction handles, and I mean, the low friction handle increase the chances, so the friction should be increased. So low friction handles and contaminants such as sweat, oil, and lead that reduce friction would seem to increase the risk by causing people to grip harder. So if the friction between the hand and the handle is less, there is a lot of sweating, or there is, for example, some lubricant, so more gripping force is required. So we can make it easier by increasing the friction at the hand-handle interface. So there could be different problems that can relate to the shoulder joint. And shoulder joint is a ball and socket joint. But it is a flexible, but at the same time, unstable joint. Because the ball part represents only a third of the surface of a sphere when it engages the socket. So 1/3 of the ball is inside the socket and 2/3 is outside the socket. Because the socket is very shallow. So this explains why the shoulder joint is easily dislocated. Dislocation of the shoulder joint is very common. This can be contrasted with a much more stable hip joint where over 50% of the femoral head, the head of the femur, is enclosed by the acetabulum, that is the socket in that joint, in that case. So this is the shoulder joint. So you could see this is the head of the humerus, this one, and this is the socket. So only 1/3 of the head, the femoral head, is inside the socket and 2/3 is outside. So this is why this muscle is the, this joint is the most mobile joint in the human body, most movable joint. But at the same time, it is at risk of dislocation as well. So use of hand tools imposes loads on the shoulder, if only indirectly. An increased risk of shoulder disorder is there when the shoulder is abducted or flexed more than 90 degrees, increasing with the time of this posture. So this posture, when the shoulder is away from the body or it is flexed, or even if it is elevated, and if the posture is extreme, then this can be very dangerous. A positive association between highly repetitive work cycles, so repetition is another cause, that is cycle time less than 30 seconds or spending more than 50% of the time doing the same task. Also, a positive relation is found between the shoulder problems and static shoulder postures. Holding the shoulder in the same posture, especially if it is abducted or flexed or any posture in which the shoulder is not relaxed. One of the simplest ways to reduce occupationally induced shoulder stress in many jobs may be to provide arm rests. That is very, very important. Or other means of supporting the weight of the arms. So if we can do that, so that we enable the shoulder muscles to relax, so then the problem of shoulder related injuries or the risk of shoulder related injuries can reduce. Another problem that we actually have discussed during our discussion on work posture is varicose veins or venous insufficiency. So venous veins are the superficial veins often in the legs, in which the valves function ineffectively, resulting in pooling of the blood and painful swelling. So deoxygenated blood accumulates and pain is caused. And the reason is damage of the valves in the lower leg. Occupational standing is thought to be associated with varicose veins in the lower extremities. The prevalence of the disorder is increased with age and number of hours spent standing at work. What is the solution? The findings suggest that standing work should be combined with other types of work in which sitting is possible. So sitting should be combined with standing, and standing tasks should be combined with sitting posture so that risk can reduce. So this is the normal vein. This one. So where the deoxygenated blood can move toward the heart to the upper part of the body, but cannot move backward. But once the valves of these veins get damaged, the blood cannot move up and it accumulates and pain is caused. You could see the change in color of the calf muscles at the skin side. So this is quite painful. So the reason is prolonged standing in restricted postures, and the solution is to allow the change in posture. In this lecture, we discussed what is epidemiology, what are some important epidemiological terms like incidence, prevalence, risk, and odds. Two terms that are generally used interchangeably are work-related musculoskeletal disorders and cumulative trauma disorders. There is slight difference between the two. The mechanism, causes, and remedies of some of the most common WMSDs, strains and sprains, tendon-related problems, osteoarthritis, epicondylitis, cervical spondylosis, carpal tunnel syndrome, disorders related to the shoulder, varicose veins, and so on. If you have any questions, you can ask.